Hello everyone, I am Dr. Kishore Kumar. I am working as consultant nephrologist and kidney transplant physician at Pace Hospitals, Hyght City, Hyderabad. Today I will be speaking about blood pressure control in patients who are undergoing hemodialysis. So kidney failure, if a patient suffers from kidney failure, there are only two options to survive. One is to undergo transplantation or they have to stay on dialysis. Dialysis is a procedure in which the blood is filtered. There are two types of dialysis. One is peritoneal dialysis, other one is hemodialysis. Hemodialysis is a dialysis which is done in hospital and or in dialysis centers, to which the patient has to come weekly thrice to undergo the procedure. Whereas peritoneal dialysis is done at home and it is done by the patient itself or a machine which can be kept at home. Especially hemodialysis. So for hemodialysis patients, they come to dialysis center or hospital to get the dialysis sessions done. So before starting dialysis, their blood pressure is checked. During dialysis and at the end of dialysis, blood pressure is checked. If we take only the pre-dialysis, that is pre-dialysis blood pressure, the blood pressure which is checked just before dialysis, or if we take the blood pressure after the dialysis, these values are not useful for these patients because a patient comes to dialysis after 2 days gap of previous dialysis. So in between these 2 days, the patient will drink water, he will take salt, because of which his weight increases and there will be more water in the body. Because of that, the blood pressure will be invariably higher at the start of dialysis. And during dialysis, water is removed from the body. And at the end of dialysis, blood pressure may be lower. So we cannot be happy assuming that the blood pressure is under control at the end of dialysis. So how to define high blood pressure in these patients? So the best method or the easiest and the important way is to measure home blood pressure. Home blood pressure monitoring in dialysis patient is a useful technique to see whether their blood pressure is under control or not. So after a midweek dialysis is a dialysis which is done in between week. So dialysis patients, they undergo 3 times a week dialysis, whether it can be Monday, Wednesday or Saturday, or Tuesday, Thursday or Saturday. So if a midweek dialysis is on Wednesday or Thursday, the day after that midweek dialysis, patients should monitor their blood pressure morning and night, and they have to do this thing for 4 weeks in a month. And they have to take an average blood pressure value of all these recordings. If the blood pressure is more than 135 by 85 millimeters of mercury, then it means that their blood pressure is not under control. So what about patients who cannot do this? So there is another method called as midweek intra-dialysis blood pressure. So as I've already mentioned, midweek dialysis is somewhere on Wednesday or Thursday. So during dialysis sessions, what is the blood pressure? We have to monitor that blood pressure. Okay, we have to see what are the blood pressure recordings. If we take during the dialysis, usually every half an hour blood pressure is checked from starting to end. And if we take all those recordings, if the median value, the middle value, if it is more than 140 by 90, it means that their blood pressure is not under control. Another accurate method is ambulatory blood pressure monitoring. Ambulatory blood pressure monitoring is a method in which a machine is attached to the patient which measures blood pressure every half an hour. Okay, so the blood pressure is measured during the daytime, during night, even if the patient is walking or he is outside. So every half an hour blood pressure is measured, and for the 44-hour time period, the average blood pressure recording is given. If that blood pressure is more than 130 by 80 millimeters of mercury, then it is called as uncontrolled blood pressure. In patients who are undergoing hemodialysis, uncontrolled blood pressure is a common problem, and many times because of this uncontrolled blood pressure, patients will land up in heart failure or they may develop brain strokes. One of the important first cause is excess fluid in the body, excess water content in the body. As we know, dialysis patients suffer. Dialysis is done in patients who suffer from kidney failure. Kidneys are important to remove excess water from the body. If kidneys are failed, excess water retains in the body, and if a patient takes more amount of water, that will be retained in the body and it will lead to increased blood pressure. Another important cause is excess salt consumption. excess salt intake will lead to more water in the body, because salt will retain more water in the body, and directly salt can also increase the blood pressure. And the third one is stimulation of sympathetic nervous system. We all have a part of nervous system called as sympathetic nervous system. It is an autonomic part of autonomic nervous system. So the damaged kidneys which a patient has will provide some signals to this sympathetic nervous system, and if this sympathetic nervous system gets activated, it will lead to increased blood pressure. So these are the causes of high blood pressure in patients undergoing dialysis. The first one is diuretics. Diuretics are the drugs which are given to patients to produce more urine. An example of diuretic is a torsemide, which is usually given to patients with kidney failure or patients who are suffering from kidney problems to produce more amount of water. Usually, any patient whose kidneys fail, initially their urine output is good. They may pass 1 liter, 1.5 liter or 2 liters also. So this urine output gradually comes down. So in the initial time, if they are producing good amount of urine output, we have to maintain that urine output by giving diuretics. Because if urine is produced in good quantities, it will remove excess water from the body. As I have already mentioned, excess water is one of the important cause of high blood pressure. So if a patient is producing good amount of urine, and if we augment it by giving more diuretics, that will help in controlling the blood pressure. The second preventive measure which patients can undertake is by restricting the salt. So salt intake in these patients is to be restricted up to 5 grams. If they take more than 5 grams of salt, it will lead to more water retention in the body. 5 grams of salt is 1 teaspoon. The salt which is present in 1 teaspoon is 5 grams of salt. And the third method is undergoing extended sessions of dialysis. Some patients undergo dialysis which is not a 4 hours duration, it may be 3 hours or 3.5 hours. Because of the lesser duration of dialysis, excess water which is present in the body may not be removed properly. So if there is excess water in the body, they have to undergo extended sessions of dialysis like 4.5 hours dialysis or 5 hours dialysis to remove excess water from the body, so that their body level, water level can be maintained and blood pressure is controlled. The first method is dry weight achievement. So what is dry weight? Dry weight is a weight below which patient will develop muscle cramps, or he may develop headache, or he may develop vomiting, or he may develop nausea sensation. So suppose a patient has a dry weight of 50 kilograms. If we decrease his weight to 49 kilograms or 49.5 kilograms during dialysis by removing extra water, he will develop all these symptoms of muscle cramps, stomach symptoms, headache, all these things. So it means that his dry weight is 50, below which we should not go. Okay. So this dry weight is attained by trial and error method, or by bioimpedance method, or by lung ultrasound method. So in the trial and error method, we gradually decrease the dry weight of the patient to know at which level the patient develops symptoms. So based on that, we will adjust his dry weight. The other method is bioimpedance method. In the bioimpedance method, there is a machine which will pass some electrical signals into the body, and it will give us how much extra water is there in the body. And based on that machine's report, we will remove that extra amount of water from the patient in the following dialysis sessions. And the third method is lung ultrasound. So excess water, if it is present in the body, it will go into the legs, it will go into the abdominal area, and it will also go into the lung. So this excess water in the lung can be identified by lung ultrasound by something called as by presence of B lines. If B lines are present in the lungs, it means that there is excess water in the body. So we will do the dialysis to remove excess water until the B lines are disappeared. Okay, gradually we will remove the extra water from the body, and we will be monitoring his lung ultrasound to see whether B lines are present in the body or not, in the lung or not. So these are the 3 methods to probe the dry weight. By probing dry weight, usually patient's blood pressure will be controlled. The other method is by antihypertensive medications. There are so many types of antihypertensive medications which the nephrologist or the treating doctor will be prescribing to the patients, which the patient should take regularly and at the times prescribed, and it can help in controlling the blood pressure. Suppose a patient has dry weight of 50 kilograms, and if he gains 5 kilos weight, and if he reaches to 55 kilograms, during dialysis, removal of this 5 kilograms weight or 5 liters of water from the body is dangerous to him, because water which is present in the body will be spread into whole body, but during dialysis, we can remove water only from the blood. So what will happen is the blood quantity will come down during dialysis, because of which the patient can develop less blood supply to the brain, which can lead to stroke also, or small ischemic strokes, or it can lead to decreased blood supply to the heart, which can lead to myocardial stunning, or it can lead to decreased blood supply to the intestines also. So excess weight gain in between dialysis sessions is not advisable for these patients. So they have to restrict salt, they have to restrict water, and restrict weight gain. So this is an important point which all dialysis patients should remember. So today we have discussed about uncontrolled blood pressure in dialysis patients. What are the reasons? What is the definition of uncontrolled blood pressure? What are the precautionary measures to be taken to prevent uncontrolled blood pressures, and what are the treatment methods for controlling the blood pressure in these patients? Thank you.